Hello and welcome to Hyperbaric Medicine Principles and Practice, 2nd edition. I'm Dr. Jeffrey Niezgoda, and I am honored to be serving as your course director. WebCME is proud to be offering the 2nd edition of this course. We have enhanced the quality of the video presentations and completely updated the course curriculum, including regulatory policies, administrative perspectives, and clinical content. This course is your gateway to the clinical practice of hyperbaric medicine and is endorsed by the American College of Hyperbaric Medicine. At the conclusion of this educational activity, you, as a student of this course, should be able to recognize the scientific basis of hyperbaric medicine and apply this understanding to patient care. Discuss the clinical applications of hyperbaric oxygen therapy. Employ therapeutic approaches in hyperbaric medicine and wound care. Understand the operational components of a hyperbaric chamber and the importance of safety and fire policies and procedures. Integrate the knowledge and understanding of hyperbaric medicine you have gained through didactic lectures and clinical case presentations throughout this course into your clinical practice and care of patients. This course offers practicing physicians, mid-level practitioners, nurses, and other allied health professionals a comprehensive overview of hyperbaric medicine, including the evaluation and management of a hyperbaric medicine patient, as well as insight into the operations of a hyperbaric facility. We utilize a team approach to enrich the delivery of the content, and we feature clinical correlations with case studies and practice pearls in an effort to enrich your educational experience. This course is designed to optimize your learning. We encourage you to review the segments as often as you need to ensure your understanding of the content. This is something that cannot be achieved in a live classroom setting, thus making this experience optimal. I'd now like to introduce you to our renowned world-class faculty. Dr. Carolyn Fife is the medical director of St. Luke's Wound Care Clinic in the Woodlands, Texas. She has been a certified wound care specialist since 1998. Dr. Fife is the co-editor of the books Wound Care Practice and Woman in Pressure, Diving and Flying. Both of these books were published by Best Publishing. Dr. Fife is also the Chief Medical Officer of IntelliCure, a Texas-based software company which, since 2000, has provided a specialty-specific electronic medical record system for wound and hyperbaric centers across the United States. She is also the Executive Director of the U.S. Wound Registry, a nonprofit organization which provides data for comparative effectiveness studies in wound care and hyperbaric medicine, and does PQRS reporting of quality measures to CMS. Dr. Fife is a recognized key opinion leader in the field of hyperbaric medicine and is the 2013 recipient of the Eric P. Kinwall Award of Excellence in Clinical Hyperbaric Medicine, which is presented by the American College of Hyperbaric Medicine. Dr. Thomas Serena is the founder and medical director of the Serena Groups, a family of wound, hyperbaric, and research companies. In this role, he has opened and operates more than 25 wound care and hyperbaric centers across the United States as well as globally. He is the Vice President of the American College of Hyperbaric Medicine and also currently serves on the board of the Association for the Advancement of Wound Care and the American Professional Wound Care Association. He has been a member of the board of directors of the Wound Healing Society and has authored 4 WHS national guidelines for the treatment of chronic wounds. He has published more than 100 papers and has given more than 350 invited lectures throughout the world. He consults for numerous wound care industrial partners in the development of new products for the wound care space. Dr. Serena has been the lead or principal investigator in over 70 clinical trials, including testing of blood platelets, gene therapy for critical limb ischemia, antimicrobial dressings, growth factors, topical and parenteral antibiotics, as well as bilayered cell therapy. In 2011, he developed a diagnostic technique that now bears his name, the Serena technique. He has founded the nation's first wound healing cooperative group, Strong. Dr. Tyler Sexton is an expert in clinical hyperbaric and diving medicine. In addition, Tyler is an acclaimed international motivational speaking and best-selling book author, documenting his challenges and accomplishments living with cerebral palsy. Dr. Sexton educates and motivates families and children with this condition, inspiring them to optimism and success. Tyler is actively involved in hyperbaric education and certification and has provided pathways to CHT, DMT, CHWS, and CHS designation for hundreds of technologists. Dr. Sexton is also a clinical professor of hyperbaric medicine and runs a DAN-certified hyperbaric center in the Caribbean, specializing in treating diving complications. He is also a board-certified pediatrician and utilizes hyperbaric medicine to treat his pediatric patients who are suffering from chronic wounds. Chris Shettle has over 18 years of clinical experience, specializing in wound care and hyperbaric medicine. She has a bachelor's in science in nursing from Messiah College and is a registered nurse certified in wound care. She is a member of the National Alliance of Wound Care and a diplomat of the American Professional Wound Care Association. Chris has extensive industry experience as well as clinical expertise and has been recognized as an honored member of Women Executives and Professionals. Over the past decade, Chris has provided wound care and hyperbaric education to thousands of clinicians at numerous local, regional, and national wound care symposiums. Sean Cawley began his wound care career in 1985 when he opened one of the first hyperbaric and wound care centers in the United States. During his 25-year career, he has consulted with many hospitals and has worked with the largest wound care contracting companies, developing wound care and hyperbaric centers throughout the country. Sean Cawley is the founder of VP Ambulatory Business Development. He is highly experienced healthcare management professional and growth leader, as well as a hospital administrator with expertise in ambulatory care programs. He has helped many hospitals avoid bankruptcy by implementing strategies to increase revenues while cutting unnecessary expenses. And last but not least, or maybe based on what you've just heard, yes, least two, I'm Dr. Jeffrey Niezgoda, your course director. I am a fellowship-trained hyperbaric medicine and wound care specialist. And for the last 15 years, I've served as the medical director of the Centers for Comprehensive Wound Care and Hyperbaric Oxygen Therapy, and as the president and chief medical officer of Hyperbaric and Wound Care Associates, associated with Aurora Healthcare at St. Luke's Medical Center here in Milwaukee, Wisconsin. I am the president of the American College of Hyperbaric Medicine and a current member of the executive committee of the American Professional Wound Care Association and an honorary life member of the Association of Military Surgeons. I have been a previous member of the executive committee of the Undersea and Hyperbaric Medical Society and have served on a pressure vessel for human occupancy subcommittee. I serve as an honorary member of the board of directors of the American Board of Wound Healing and have participated in the creation of the Physician Certification Examination in Wound Care, the Physician's Hyperbaric Certification Examination, and the Certified Hyperbaric and Wound Care Specialist Examination. I am also the founder and president of WebCME, and I am very proud to tell you that WebCME has trained over 3,000 physicians and nurses in the areas of hyperbaric oxygen therapy and advanced wound care. I've had the honor of participating on multiple expert consensus panels and have appeared before Medicare and Medicaid Services and the Food and Drug Administration to provide expert opinion in several areas related to wound care. I have been privileged to lecture extensively both on hyperbaric oxygen therapy and advanced wound care, and have presented over 300 podium and poster presentations at national and international conferences. I am a life member of the National Eagle Scout Association and the founder and president emeritus of the Association for Bladder Exstrophy Children. On behalf of the entire faculty of Hyperbaric Medicine Principles and Practice, I would like to welcome you to our course. This course is only a starting point for your educational process in hyperbaric medicine. We highly encourage you to continue to build your skill set and expand your mastery of hyperbaric medicine through mentoring and proctoring at your own facility. Hands-on patient care and operational experience will serve to reinforce the concepts presented in this course. Good luck, and we hope you enjoy this experience.